And welcome. I'm so glad you're here. My name is Renee, and we just started a second time because I forgot to go live today. How's that for tech on a Monday? I'm just here to say thanks so much for joining us. If you're here, you care about policy at home, at work, and in the community. And I'm Renee. I'm a clinician by trade. I have been a politician. I'm a recovering politician, and I've been a workaholic, and I'm a reformed workaholic, all about work-life balance. And so when we think about why would we want to create policy at work, at home, or in the community, it's to be more balanced in our life and to be healthier as people. And so we care so much about that. We're so grateful that you're here. I want to say that special thanks to Eugenia for inviting her friends to join our group. We've had several of her friends join, and I'm so excited that you all are here. Thank you so much for that. I also want to say a special shout out to Tanya and Elisa, who always catch us on the replay. So today, if you're catching us on the replay, put replay in the chat. And today we're going to be talking about finding champions. So put the word champions if you're here live with us today, or if you're catching us on replay, to let us know that you were here with us. And I'm going to show you today how you go about building stakeholders as people that you might need on your team. And you're thinking about, we're trying to find champions, people that care about what we care about, that people that can help move us forward, who can help move us down the path of what we're trying to do. But sometimes you need to build a team of people that you can help move something forward. I'll give you an example. One of the things that passed last year in nationwide was a 3-digit number called 988. That is going to be the equivalent to the 911 we all know about in America, but this one's for mental health. And if you know anything about the story about 911, it took almost 30 years for that to get completely rolled out around the country. We don't really think about that because most everybody knows 911 today. But some of the things that did not go correctly with 911 when the implementation is it didn't have funding for it to go out nationwide. It was kind of piecemealed together. And so now as we're trying to roll out 988, which is going to be the mental health version of a 911. So instead of calling 911, which was originally designed for heart attacks, strokes, things of that nature, now 988 is going to be where you call if you have a crisis for your mental health, if you have suicidal thoughts, if you need resources, if you need help. Instead of calling your regular 911 where officers come, you would have 988 where people trained in mental health would come. Well, in that policy, you need stakeholders who are going to help create a policy and help fund it across the country, right? Because otherwise it's going to get piecemealed together, just like 911 did, and nobody wants this to take 30 years for it to work. And so everybody's thinking about who should be at the table. That's what we're talking about today. Who needs to be at the table to make your policy a success? So in 988, you have people that need to use the policy, you have people who need to fund it, then you have those actual stakeholders behind the scenes that are those people that, answer the calls, that connect the dots from the caller to, the switchboard operators like back in the day. But all that technology behind the scenes, when the phone rings, where is it going to go? Who's going to get the number? Then who's going to react? And in 988, there is 3 pieces that are supposed to be happening. Somebody's supposed to answer, but then somebody's supposed to be able to respond and to go out and to meet people if they're in crisis. And then the third thing is there's supposed to be a place for people to go. And so that's going to take a while for all of that to be built up. But when you're thinking about that, different pieces need to be at the table, right? For there to be somebody to respond, who's the mobile response? Who's going to be the one to say go? Who's going to be the people to go? What are the training of those kinds of people? And then if there's going to be a place for people to go, where are you connecting them to? What does the crisis center look like that a person can go to? And we're always trying to keep people with mental health crisis out of the emergency room unless it's a medical condition, because oftentimes it just clogs up our medical rooms and there's not the right care for the right level of need. And so we're trying to make sure we get people to the right places. You know what I'm saying? So we're talking about stakeholders. So today I'm going to do something a little different we don't always do, but I'm going to share my screen and we're going to talk about what does it look like to look at stakeholders. So if we're going to build stakeholders, there's different categories and different types of stakeholders that you need to be thinking about when you're thinking about who needs to be at the table for this conversation. And we can use 988 as our example, or I might think of another as we go along. But when you're thinking about who's involved, you've got to think of who is directly affected by the project. Who's affected by this, right? Who's going to be affected and who does it affect, right? So who is impacted? Who's going to be the people impacted by what you're trying to do, right? So those involved in the delivery of the product that you're trying to do, it could be a lot of different people, right? There could be school board members involved, there could be clients, there could be legislators, there could be investors and donors, there could be lobbyists, consultants, insurance. And then the issue of like 988, it could be cell phone companies, it could be, the people that have the power lines and the cell towers and all of the behind the scenes, right? All of that infrastructure. Who are these people? And in a lot of cases, then there's also going to be taxes associated with it. So places like Verizon, they started their 988 tax last year. So in your bill, if you go to an itemized bill, you should see a surcharge for the use of 988. Some carriers have already started that as a way to help fund the system to make sure that that gets paid for, right? So when you're thinking about building a stakeholder list, who needs to be at the table? And this, you go back to the beginning of what are you trying to accomplish? So 988 is a federal initiative, but states are involved and it has to work locally. So the people responding have to be local. So that's talking about your cities, your counties, your local providers. And so you've got people at all levels of government that have to work together seamlessly to make that work. If you're going to have people actually respond and go somewhere, right? So when you make a phone call, it needs to be answered locally if it can be. But then if you're going to have somebody respond mobilely, it absolutely has to be local, because you can't just have a response out of California for Iowa, right? You've got to have people connected in Iowa who can go out. And even that needs to be more localized to the local county, to the local city, the people that can actually get there in a timely manner, right? You can't just have a dispatch from, say, the county, the state capital, if you will, for the whole state. You won't get there and you won't be timely and people won't get served. So you're talking about what levels of government, right? So in this case, it could be a lot of different people at the table, right? Local legislators are going to have impact at the state level on taxes and maybe on monies that are having to be collected to pay for things. You've got all of your commodities, the people that pay for telephone and all the infrastructure, they're going to be involved. You're going to have probably police and fire and those that currently answer those crisis calls involved, because what is 911's role going to be moving forward, right? So you've got to think about who are all these players. So in a project big like this, you may have to have different subgroups of people, but it's going to take a lot of stakeholders for this to get to work, right? So it's not just as easy as flip a switch at the federal government level and then 988 exists across the state. It's not that way at all. And so you've got to think about who needs to be there and then determine the context. So this is where more people get involved, like your local authorities, your state government departments, your governmental leadership, your non-departmental public bodies, like maybe housing agencies or environmental agencies. And when you think of things like cell phones, right, that's like infrastructure. You're talking about towers. You're talking about wires in some case, right? There's still wires connected to wireless. We always forget that part. We think, oh, well, it's just wireless. Well, actually, there's wires that things travel along underground or sometimes in the air, depending still. And so you've got to think of who owns the infrastructure for something like that. And what do they need to make changes? And how much is it going to cost for them to make the changes that we need to get a number like 988 available to everyone? What's that even going to cost, right? So then who's affected by the project? So you've got people, primary stakeholders that are directly impacted. And the people you want directly impacted are the users. So family members, children, healthcare workers, the people on the front line, the people that are making the call in crisis, those are your primary people. You want to make sure that they're at the table, right? What do they need when they get a crisis call? Do they want uniformed officers showing up when there's a crisis call? There's a big argument about that right now, because there's a lot of research to show when uniformed officers show up, that it heightens the issue and makes it more flammable, if you will, and makes it more likely to be explosive than if you have people in plain clothes that are more trained in mental health show up. They can calm the situation down faster. But there's a big argument about that. People think that there's a lot of really dangerous people out there and that they need uniformed officers to respond. Other people are out there fighting, saying that's what's making it so, explosive, is the uniformed officers. And if we could go without it, right? That's a big discussion. So who responds when you call 988 is a big deal. So the people that's on the front line, what do they need? Who needs to respond? That's the primary stakeholder. The secondary stakeholders may be directly or indirectly affected by depending on the context. So you could have other community members, right? General public, local community groups, specific demographic groups based on their race and ethnicity and gender. Emergency departments are impacted, right? If we start getting people on a call, text or chat, if you take them and get them calmed down, that's less people through the ED doors. So you have less people blocking up the emergency room system. And so you wouldn't have as many beds filled per se. You might be able to have more people getting served at other types of mental or medical needs that they have, right? There's a lot of people impacted. So when you start thinking about, okay, who's secondarily impacted, you want your hospitals need to be part of this discussion. What do they need you to do? What types of people do they get in their ED that are not appropriate for them, that needs to be taken care of elsewhere? What do we see is the people that are clogging up the emergency beds so that people with a heart attack can't get the services they need. And then when you're thinking about that third leg, that part of somewhere to go, what do people need to be able to be safe in a crisis that may not look like an emergency room? And for those of you, if you've ever had anyone that you know that have been suicidal, and I have had a few, and I've had to go with them to the emergency room, not all emergency departments are prepared for a person who's suicidal, right? There's lots of wires and lots of cords and lots of things around that can actually be challenging for a person that's suicidal, because they could use those to harm themselves, or if they're homicidal, to harm others. And so you have to think about what kind of place are we talking that would be safe and contained for a person that's really thinking about harming themselves or others, and what do they need, right? So all of those people need to be at the table in a project such as 988. And in your own project, who are you trying to impact? Who is the customer, but who are the people around them? The local community cares. So here's another example. They're building a sobering center in our community, and it's going to go in a particular neighborhood. And the particular neighborhood, it's close to an emergency department. It's close to where they already have a lot of mental health services. So logically, that makes a good bit of sense to put it in the same community. But the community, there's some pushback about that, because they don't want only that in their community. They want to have other types of business in their community. They want to have other types of opportunities for work and employment. And so there's some pushback about where this goes. They would be secondary stakeholders, the people where the community projects are going to go. They have input in this too. So when you're thinking about stakeholders, make sure like who is not at the table, who needs to be there. The last group is kind of others that are interested. The media get involved here. People that do research get involved here, because maybe they want to follow what you're doing to be able to show an evidence-based practice or a promising practice. You have to have research on that. It could be an example or a pilot project. We call them a lot in our state, where you do a pilot project, which is a smaller version of something you'd like to roll out statewide. And to do that, you have to start it somewhere. And if it goes well and you collect the data on that, then you can show that this might work in other communities, right? So when you're thinking about stakeholders, it's a lot bigger conversation than a lot of us think about. A lot of us just think about, oh, well, these people are directly impacted, we need them, and maybe their family. But it goes much beyond that. So when you're thinking about something, especially in mental health, lots of different groups are involved. So how do you make sure that they all feel welcome at the table, and make sure that they have a voice, and make sure that they can give you the information that is needed? That's what we're talking about this week. So when you start thinking about what's important to you, and you're looking for your champions, and you're looking for how do you move issues forward, make sure that you fill in those blanks with the blind spots. What happens if you don't? This is a word of warning. If you leave out a key constituent group and you try to move policy forward, they will be the ones in the end that will kill the initiative you're trying to make. Because if a big group shows up that has not been consulted, that's the fastest way for something to die. People will say, we can't move this because these folks will be harmed, or they weren't considered, or they didn't have input, or whatever. And then bad things happen. So you don't want to be caught off guard. The larger your stakeholder group, the more feedback you get, even if it's not agreeing with you, but the more they have input into what you're trying to do, the more likely you will have to have success in moving forward on your path of policy. That's all I had for you today. Come back next week. We'll talk a little bit more about stakeholders. We'll see you then. Have a great